Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to our team working in the Knox County Health Department phone information line. As of yesterday, our phone bank operators have received more than 10,000 calls since the information line became operational in March. That's huge. This team has been a valuable resource to our community, scheduling appointments for testing and continuing to answer questions about COVID-19 and our local response. And we're very grateful to them for all the work that they're doing. Now we'd like to talk a little bit about testing availability. KCHD has drive-through testing 3 days a week, Monday, Wednesdays, and Fridays, and is doing targeted testing on Tuesdays and Thursdays for high-risk populations or those with less access to testing. You can also get tested elsewhere in the community. Private providers and walk-in clinics have made us aware of their testing, and we've added those locations to the interactive map on our website. Our phone bank also has access to this map and can share these locations with people calling our information line. And again, that number is 865-215-5555. Moving on to our local situation, we have 307 confirmed cases of COVID-19 in Knox County. Additionally, we have 5 probable cases. 233 of our cases have recovered. 37 individuals have been hospitalized at some point in their illness, and 2 are currently hospitalized. And we are thankful that we have no additional deaths due to complications from COVID-19. Before we open it up for questions, we want to talk a little bit about masks because we're getting a lot of questions about them. Remember, wearing a mask isn't just about you. Your mask protects me, and my mask protects you. We're talking about your loved ones, your neighbors, your friends. These are all people that could be at high risk of complications that can benefit from you wearing a mask. So before going out in public, we do ask that you remember these people when considering whether or not to put on a mask. We'll now open it up for questions.
All right, the first question that we have submitted is from WBLT. Says a viewer is saying she received a mask from the Knox County Health Department. She's a retired RN concerned about the effectiveness. So their question is a couple of them. The first one is, do these masks appear to meet CDC guidelines?
The masks that we've received from Tennessee Department of Health, they secured the mask and have provided to those to us to give out. They do appear to us that they would stop or limit the spread of droplets coming from your mouth. So more direct questions on the mask, we would refer to them.
The second question they have in regards to this is, has the department changed the masks/material that were initially distributed?
At this time, we haven't received any different mask. Again, if they're looking to do that, I would talk to the state since they are the ones that are getting those masks.
All right, I think that answers your third question there, David. The fourth question is this how the masks should look?
I can't see what you're showing, but CDC guidance says it should be a cloth mask. You should be able to tie it behind your head, wear it behind your ears. It should be fit snug to your face. There's additional CDC guidance. I suggest you look at that, but I can't see. I'm sorry, it's a picture. Yeah, it's nothing special. I should say, they should be a cloth face covering. You can use bandanas, you can use t-shirts. There's a lot of different ways that the mask can be made. The whole point of the mask is to limit the spread of droplets coming from me to you. And that's what we're trying to do.
Also from WVLT, they say they want to request the updated number of complaints that were made about overcrowded restaurants or businesses for last Monday through Sunday.
I don't know if they're specifically related to overcrowding, but we have received 131 total complaints since May 1st, and that our team is investigating and providing education to those businesses. Some of them actually aren't even violations. They're just following up when they get there to see what the businesses are doing and providing education when needed.
From WBIR, at this time, what's the probability local pools and splash pads will be able to reopen this summer? What guidance are you giving aquatic areas here locally in the
In the meantime, right now they're not open. I think with looking forward, we really need to see what the situation's looking like. We're kind of right now getting into the point where we might start seeing more cases associated with reopening so that we have an idea of what the impact's been from the places that we've opened, allowed to be open at this point in time. But there will be guidance coming soon from the task force as they are looking into all that. But I don't have more details than that right now.
From WATE, Pratt's Country Store in Fountain City says that someone in its inner circle has been exposed to the virus. The store is waiting to close until the end of the day tomorrow. Is that sufficient? Should it have closed earlier?
We don't speak about specific locations typically, but I can say that what we do look at is making sure that the people who are positive cases and their close contacts are at home quarantining or isolating away from the general public. So if a business is able to have people that were not exposed and keep open, then they can do that. That's not out of the guidelines. So we specifically look at the close contacts and the individuals that tested positive.
From WBIR, how many masks have been given out so far? Have you received more or no one will receive more?
We've received a lot, so more is not an issue right now. I know that we handed out over 900 yesterday. I'll have to get you the total number. We'll get that back to you later today. They're making a note on it. And we've received more than 20. We've given out more than 20,000? Okay. Okay. So we've given out a lot. We'll get you the total number, but I know we handed out here at Knox County Health Department over 900 yesterday. That was reported this morning.
From the Sentinel, Vanderbilt drastically reset their hospitalization forecast to just 300 people for the entire state. Can you comment on this and say whether or not it changes procedure/policy going forward?
I honestly haven't seen Vanderbilt's updated report, so we'll look into that. But I can say we're still looking every day, and the hospitals are looking at our local data for hospitalizations due to COVID and what their capacity looks like. They're looking at that very closely every day, as Dr. Gray said when he was here last week, and we're reporting weekly on what the COVID cases are in the hospitals for Knox County in our region.
From the Compass, Dr. Buchanan said that testing would be held this weekend at Knoxville's public housing developments. Mm-hmm. Have there been clusters at any of the public housing communities in Knoxville?
We have not had clusters associated with the public housing communities. This is an initiative by the state, and we are helping with that. And those are happening this weekend on Saturday and Sunday with more details to come. They're working on the exact schedule today, and we'll get that out as soon as we can.
From WBIR, going back to pools, for people with personal pools, would they be able to have other people who do not live in their household in their pool this summer? What is KCHD recommending at this time? We
would recommend that you follow the general guidance for getting together in social gatherings and keeping that below 10 people. But it's your pool, and you can be in your pool if you want for your own personal pools. But we do ask that you try to limit. And again, this is all about going to do everything that we can do to limit the spread and keep the spread of this disease at a low level so that we can respond and the hospitals can respond. That's where all of these recommendations come from. So we ask you consider that.
Any other questions? Please go ahead and submit them now. From WBIR, I know you said you won't comment on specific businesses, but in general, if one says it is closing because of employees testing positive, do people who have gone to that store in recent days need to get tested? Are they at risk? So in general, let's talk about what risk and close contacts are. And so that's going back to within 6 feet for more than 10 minutes. So in general, at a store, if you're just paying for your groceries or paying for food or something along those lines, it's really considered pretty low risk. If you're concerned, you can always get tested. We do suggest you wait a few days. But we also recommend that this is the other reason to make sure that we're practicing good social distancing, that you're keeping 6 feet away from people, you're washing your hands frequently, that people in these businesses are wearing masks to protect you and that you're wearing masks to protect them. All of those things still come into play here. But if you're concerned, talk to your provider and you can get tested, but it's not something that we consider close contacts based on the time and the space of exposure. From WBIR, you told us yesterday KCHD and the National Guard will be doing mass testing of folks in public housing this weekend. Can you talk a little bit more about that, what it will look like and how it will work?
They're going to be in 3 facilities on Saturday and 3 on Sunday. I will have to get the details of what time and the exact specific locations that we'll be at to you. Hopefully we'll be able to release that tomorrow. They're working on finalizing the schedule today, so we don't want to put out any misinformation, but we will be in 3 facilities on Saturday and 3 locations on Sunday.
From WVLT, with Memorial Day coming up, what message do you have for the community?
Really, again, we just want to stress the need of those 5 core principles that we keep talking about. So keeping social distancing, so staying 6 feet away from people, not congregating in large groups and mixing, wearing masks if you can't stay away from people when you're in public, washing your hands, frequently disinfecting surfaces. So you can do that if you have a few people over to your house, 2 or 3 people over, make sure you're cleaning things regularly. All of those things. Don't participate if you're sick. That's very important as well. All of those things. We really don't want to see spikes that related to this, and will help prevent or limit the spread of disease in our community. So we ask that you continue to do all of those things we've been asking.
Next question is, are we on a positive track through phase 1?
So far, we've been, we're just 2 weeks into phase 1, and it's been looking good with our data. We haven't seen a lot of flags. We had 1 flag for positive cases due to the cluster testing that we talked about last week. But outside of that, so far, things are looking good, and we hope they continue to stay that way.
From WBIR, Children's Hospital said they might have 2 cases of the mysterious COVID-related illness appearing in children. Have you heard of any additional ones here?
We have not. I saw the same report from Children's. That is something that the state's asking gets reported if they are investigating or find that their children do have anything that looks like those illnesses that could be related. But I don't know of any other reports at this time.
A follow-up question is, aside from children, are there any other new presentations / new symptoms of COVID-19 that you're seeing in the community?
No, just what we've been talking about. So either asymptomatic, which can occur, which is, again, where we go back to all of the measures that we recommend, because you can have it and not know it. But also cough, fever, shortness of breath. You may have some headache, you may not feel good, some achiness, nausea and vomiting, and loss of taste and smell. Those are the main ones that we're still seeing.
Any other additional questions? Please go ahead and submit them now. All right, looks like there's no additional questions. We appreciate you all joining us, and we will see you tomorrow at the same time. Thank you.